Sacramento Elder Care Channel studio today with Carolyn Klinker, a medical social worker with Advanced Home Health and Hospice. Hi, Carolyn.
Hi.
Carolyn, you are a social worker in the home health and hospice environment. What motivates you to work in these areas?
Well, being a social worker, I love advocating for people. And what I love about social workers in the medical profession is we get to look at people outside of just the medical diagnosis of who they are. So, for example, I love that someone with, for example, cirrhosis of liver or dementia, they are more than someone that is confused about who they are. They are a mom, a dad. They are still that person, sadly just masked by a disease. And I get to kind of help be that voice for them and advocate that we still treat them as such, help them with community resources and everything.
How long have you been with Advanced Home Health and Hospice?
I've been with hospice for about 3 years, and I've been in medical social work since '07. So for almost 10 years, I've been in medical social work through skilled nursing facilities, hospitals, cancer centers, home health.
Can you tell me more about Advanced Home Health and Hospice?
Yeah, Advanced Home Health and Hospice, we're a great company. We're really a tight unit. We're privately owned. We have a doctor and husband and wife, doctor and nurse, who own our company. They started out of a passion for seeing their own parents through the dying process. They really have a heart for the Sacramento community and really meeting the needs of seniors in this county. I love that we as a company, as a community of people, we really strive to help people make the end chapter, that last chapter of their life, meaningful. We like to really create moments of togetherness for patients and their family members, whether that be through massage therapy and touch, and creating moments for touching one another in that therapeutic way, whether that be through delivering flowers. We deliver flowers to patients on a weekly basis and family members as well. And whether that be to create magical moments that they've wanted to accomplish at that last chapter of their life. And I have a few stories to share, if that's okay with you.
Boy, you told me some stories earlier, and they were great stories, so I'd love for you to share them with our audience.
So the love I have for this kind of work is, I'll give two stories. One is a couple that I had in a nursing home. The husband was our patient, and he and his wife both lost their home, and they were in a nursing home together. He had shared with me that it was their anniversary coming up, and I kind of had an inkling that maybe he wasn't going to make it to celebrate that anniversary, and so we just went ahead and threw them an anniversary dinner beforehand. We found their engagement photo, we blew it up, we got their favorite Chinese restaurant, we got that food. I dressed up like a waitress, and we went ahead and had them have this romantic moment where they celebrated their marriage, because there's nothing that says you can't celebrate today, even though your anniversary is in 2 weeks. And it was really beautiful to watch them really be able to say the things that they wanted to say to each other before it was too late to say those things. So the fact that we got to celebrate them was amazing. The other story is of a 23-year-old. She had cystic fibrosis, and she wanted to give her mom a moment that she knew she wasn't going to be able to, and that was trying on wedding dresses. So we got to get David's bridal involved, and hair and makeup and photography, and we got to make that girl feel like a princess. We got to take her oxygen off for 5 seconds if she could stand it, and her mom will forever hold those photos and have those memories of watching her daughter feel like a beautiful bride and a beautiful princess. And I love that our company believes in that. We believe in it wholeheartedly, more than looking at them as that diagnosis, but looking at them as that person, as my family member. I would want to do those beautiful moments if it were my family member too. So to have that support is so meaningful to me.
Well, those are two amazing stories, and I certainly understand why you're motivated to do what you do. You told me a little bit about the path that you have to take to become a medical social worker, and it's a lot of education, a lot of hours, and a lot of effort to do what you do. And I just have to say that we're very excited to have Advanced Home Health and Hospice on the Sacramento Elder Care Channel. And we certainly appreciated you taking out time today from your work to come in and sit down and chat with us.
Yeah, my pleasure. Thank you.
You're welcome.